Hello, Mr. Chaparro.
How you doing, sir?
Welcome. Thanks for coming. How are you feeling?
I'm doing good, thank you.
Good. Right. Let's just start by tell me something about yourself.
Well, I've been an occupational therapist for the past 3 years. Work mainly with pediatrics. I'm applying for a position in geriatrics. It's because I want to expand my knowledge. I want to work with adults and maybe in the future maybe work in mental health as well. See a little bit, like work a little bit in all different aspects of what occupational therapists do.
That's
Um,
good.
Thank you.
How did you become interested in OT?
Became interested doing some observation hours in school before I had an opportunity to find out what occupational therapy was. I observed some children in hospitals, and I stayed for 2 sessions of occupational therapy to specific clients that I was observing. Um, and I became really interested, and since then I started investigating and trying to see what I needed in order to become an OT and to fulfill a little bit of the prerequisites I needed for that career. And once I did that, I knew that after more observation hours, I knew that this was the field for me.
And why did you choose to apply for this position?
Uh, I heard about this clinic, and it's pretty much what I always wanted to do. I always wanted to work with. My main goal first was to work in a geriatrics. I I had the opportunity to work with pediatrics for the first 3 years in my career, but and it was a great experience. Um, but I thought that it was time for me to move on to what I think it's my calling, which is working in the geriatrics.
Why do you think we should hire you?
I believe that I have a lot of experience. I have a lot of knowledge of different assessments and different tools I can use. Another thing is that I'm really motivated to help, and it's my main goal to see progress and to see what I can do. I know that there's a possibility that sometimes even though as much as you want to help a person and as much as you want to see progress, there's I'm really um, knowledgeable that sometimes it hits a plateau and you cannot see progress. But anything I can do in order to help that person, that's why I'm here.
Tell me about your previous job experience and why did you decide to look for something else?
I started off in a clinic that specializes in only children uh, from 0 to 14 years of age. With I saw a wide range of diagnoses from cerebral palsy to Down syndrome. Um, there's I had not I didn't have a lot of knowledge going into pediatrics due to the fact that I wanted to start in geriatrics as my first choice. But I had fun. Like I actually learned a lot, and I know that in this environment, and that's why I wanna progress in my knowledge as a therapist.
What do you think are your biggest strong points?
My strongest points maybe is that I get in touch with with patients' needs. I want to fulfill their goals. If uh, I always talk to the family members. I try to educate them as much as I can. Try to enforce them to continue the skills that I provide for them or the activities that I provide for them so they can continue at home. Um, if a patient wants to continue doing something and to improve his life, so social skills. I try to implement in every session that I see him or see her a little bit of that, so they can know that I'm working for them.
Uh, what do you think you would do well in this job?
I'm a fast learner, and I always want to learn more about different assessments, different tools that I can use. Since I've never been in geriatrics, I believe that this is a good. I need this as my experience. I want to be a well-rounded occupational therapist. So I believe that right now is a time that it's a good time that I decided to fulfill this requirement and go into a different field, which is geriatrics.
Okay, what motivates you to do your best on the job?
Myself and my daughter. I want to be someone that she can look up to, and she's my biggest inspiration in this and doing what I do.
Okay. How would you handle a situation if you dislike the patient?
First of all, I will always try to figure out what is it that the patient is uncomfortable with, and if it's me that he or she feels uncomfortable, I will try to implement changes in myself in order for him or her to feel comfortable with me. If it progresses, I will I will let my clinical instructor know what's going on, and maybe they can sit in the sessions to see if he or she can, my CI can actually identify what is it that may be causing the problem. And if it progresses and if we don't see any improvement, and I will let the, the CI take it from there to see what would be the best for in the interest of the patient.
Okay, tell me about a time when you had to handle an irritated physician, coworker, or patient.
I had a little girl that she was 6 years old. She had Down syndrome, and her mom was really protective. Um, I was doing some minor muscle testing just to check her endurance and to check her strength, a little bit of range of motion. Um, I had to get into close with the patient, maybe because she was a little girl, she maybe, and I'm a male, so maybe she did feel a little bit comfortable. So in that time, I asked one of my colleagues to provide the session for me while I was observing. This way, my mom will feel a little better, and will take that peace of mind, so she can have that peace of mind that it was someone else, female.
What is your most memorable experience working with a patient?
Uh, um, I have lots of them. Uh, just observing the progress of what I implemented in my goals. Like once they reach some of the goals that they want to accomplish, I think that's the most memorable thing. Once they fulfill what they want to do and they live happy after a session of therapy.
Tell me about a time you dealt with an ethical problem.
Um, everything I document everything I have. Uh, for some reason, I did observe some mistreatment in some of my one of my colleagues I did observe that he was did something that he was not supposed to do, even though it was not harmful physically to the child. Maybe, but it was a little bit emotionally, maybe a little bit mentally. I had to talk to my CI first and try to see if something can be done.
How do you handle stress and pressure?
I usually is keep everything to myself, and if I feel stressed or pressured, I try to leave that at home and just go to work for my patients, which is my main goal.
Okay. How do you remain current on topics of occupational therapy?
I go to seminars and I go to different CEUs. I try to I go to the website IOTA try to go to the conference at least once every 2 years. Um, every article on the journals, I keep I keep posted in comments from like other colleagues. I talk about in the meetings. We talk about different approaches that we can use, and we try to implement them so we can be well-rounded in what we do.
So, do you have any questions for me?
No, sir. Thank you so much.
Okay. All right, Mr. Chaparro.
Thank you.
So much for
Appreciate it.
coming. We'll let you know.
Thank you, sir. Have a good day.